Chapter 11. Treatments you can give. Water is one of nature's great healers. In the treatment of disease, water has been used since the dawn of history. Hydrotherapy is the scientific term for treatments in which water is used. Hydro means water, therapy means treatment. However, it is most important to realize that though hydrotherapy is very valuable, it is no substitute for good medical care. Make no mistake about this. In any serious illness you must rely on your doctor. Under his guidance you can do much to help someone who is ill with a cold or an attack of influenza. Water is a very adaptable substance. At low temperatures it turns to ice. At normal room temperatures it is a liquid. When heated it readily turns to steam. All of these changes have a marked effect upon the body, and water can be used to great advantage in each form. Ice is very useful in treating acute swellings of the tissues, especially following some injury such as a badly sprained ankle. On the other hand, hot water, or heat in any form, increases the blood flow to the affected area. Even steam is very useful in relieving congestion. Here are a few treatments commonly used today. Medicated steam inhalation. This is an excellent form of treatment for a head cold. All you need is a kettle with a spout. Fill the vessel half full of water. Add a little oil of eucalyptus or compound tincture of benzoin, or some Vicks VapoRub or similar medication. These simple medicine help to open the windpipes and relieve the congestion. The steam itself, however, is always the most important part of the treatment. Now open an umbrella and place it behind the patient's head, as shown in the picture. Throw a sheet over the umbrella to provide a tent, and use a stove or some other means for keeping the water hot. If the water is already hot, you will only need very low heat. Make sure the steam comes up through the spout of the kettle freely. Form. 92 treatments you can give. A paper or cardboard tube to carry the steam up under the tent. Next, soak a small piece of gauze in eucalyptus or other medication, and lay the gauze over the top of the newspaper cone or tube. Allow the steam to pass up the tube and under the tent for about 20 to 30 minutes. This medicated steam inhalation is very useful in treating head colds, sinus trouble, bronchitis, croup, and pneumonia. Be careful in treating a young child. Always have an adult stay close by to prevent any accidents. Do not allow the patient to become burned or chilled during this procedure. Emergency treatment for croup. If your child has a sudden attack of croup in the middle of the night, try to have him breathe steam in some for without delay. Steam inhalation as described above is satisfactory. Be sure to call the doctor as soon as possible. Meanwhile, keep yourself calm and quiet and avoid any sign of panic. Otherwise, the child might share your fright and thus find it still harder to breathe normally. Hot foot bath. Another useful water treatment is the hot foot bath. This helps relieve congestion in the nose and sinuses, and aids those who suffer from cold feet. It is also valuable in relieving nervous tension. Not. Hot water bottle 93. Only is it effective in easing head colds and tension headaches, but it is also an excellent way of relieving pelvic cramps, and is certainly better than using pain-killing drugs. The foot tub should be half filled with warm water, several degrees above ordinary body heat. Test the temperature with your hand. If too cool, add more warm water, but always be careful not to burn the skin. Keep the patient warm during this treatment. Wrap a blanket around him and apply a cold compress to the head. Hot water bottle. In these modern days it may seem strange to mention this old-fashioned method of applying specialized heat to certain areas of the body. Yet the hot water bottle is still very useful and inexpensive. Fill the bottle only half full, using water just hot enough to be comfortable, but not too hot. Before replacing the stopper, lay the hot water bag on the table, holding the neck upward and allowing the steam to escape. When the bag feels fairly flat, screw the stopper tightly in place while still holding the end up. Then dry the rubber part of the bag and wrap a cloth cover around it. Never use a hot water bottle without a cover, as this may burn the skin. As the bag cools, empty it and fill again with hot water. When 94 treatments you can give. Treating a sore throat 95. The treatment is completed, be sure to empty the bag and allow it to dry. Hang it upside down, open and ready to use again when needed. This simple treatment is beneficial in cases of shock, but be especially careful not to burn the unconscious or partially paralyzed patient. Heating compress. This is an excellent means of treating a sore throat. It is often more effective than expensive medications. First, select a piece of cloth, such as a large handkerchief. Fold it about 3 inches wide and 12 to 15 inches long. Dip this in cold water and wiring it out as dry as possible. Wrap this around the patient's neck and cover it with several thickness of flannel or woolen material about 4 inches wide. Fasten the compress in place with safety pins and leave it on all night. Within a few minutes the compress will feel warm. 96 treatments you can give, and will have a soothing effect on the throat. This compress should be changed every 8 hours. The heating compress is very useful in treating hoarseness or laryngitis, and also relieving stiffness in the neck muscles following an injury. Many cases acute tonsillitis have been successfully treated by this simple means. Be sure the compress is neither too tight nor too loose. Continue this simple treatment for several nights in succession, and you will be surprised at the relief it will bring. Hot packs and fomentations. Hot packs and fomentations are useful in treating local pains and muscle injuries in the arms, legs and back. They are also of value in fomentations 97. Treating chest colds, influenza, croup, bronchitis, laryngitis, pleurisy, and inflammation in any part of the body. Patients suffering from polio and arthritis may also derive benefit from fomentations. But the greatest value of this form of water treatment is found in cases of colds and respiratory infection. Select a piece of blanket or flannel large enough to fit over the chest or back. Fold it into a pack, dip it in very hot water, and wring it out as dry as possible. Wrap this in a dry Turkish towel, or other material thick enough to protect the skin, and apply the whole pack to the area to be treated. This is known as a fomentation. Leave the hot pack in place for 10 or 15 minutes, or until it is cool. Then rub the area with a small piece of ice or a cold cloth and dry the skin with a rough Turkish towel. The pack, or fomentation, massage, or heavy rubbing, as suggested on page 105. If you are treating a patient with a chest cold, first apply the fomentation to the back, and then later treat the chest. Better still. Cold mitten friction 99. Use 2 packs at the same time, front and back. At the conclusion of the treatment, wipe the skin dry and apply rubbing alcohol, or some other soothing lotion. Cold mitten friction. Many people are looking for some kind of tonic, usually a pill or something out of a bottle. Yet, one of the best tonics of all is the cold mitten friction. All you need for this is a small washcloth or 2 and a basin of cold water, preferably with ice floating in it. If you are treating a patient in bed, be sure to protect the bedclothes with a covering of paper or plastic material. Dip the washcloths in the cold water and wiring them out so that they are just damp. With 1 washcloth in each hand, rub the skin vigorously until it glows. Treat one extremity at a time, drying it off immediately to prevent chilling. It is best to treat the chest and back as well. Nothing will tone up the body and increase the blood flow to 100 treatments you can give the skin like this simple cold mitten friction. Its effectiveness is increased if administered after giving the hot pack treatment as described above. Ice packs. Ice packs are useful in treating injured joints and muscles, especially during the acute stage. Wrap a light towel around the part to be treated. Next, pack small pieces of ice over the area, and cover this with some light plastic waterproof material. Add another towel and leave the whole pack in place for 20 to 30 minutes. Be sure the bed is protected by a plastic or rubber sheet. Repeat the treatment every 3 or 4 hours, as may be needed. This treatment Giving an enema 101 is valuable for cases of acute bursitis and for sprains of the wrist, ankle, or other joints. Giving an enema. There are times when a cleansing enema may be needed, but this should not be very often. Nor should one give this treatment without due thought. Treating an organ like the colon should never be left to the decision of an amateur. However, if your doctor suggests that you give your patient an enema, this is how it should be done. First of all, you will need some type of irrigation can or container. You should also have a rubber tube about 3 feet long. One end is connected to the irrigating can. The other end is attached to a hard rubber enema tip, or perhaps a small rectal tube. 102 treatments you can give. Lay the patient on his side, with his knees drawn up. Apply some suitable lubricant, such as Vaseline, to the enema tip. Insert the tip into the rectum, usually about 3 or 4 inches. Allow the water to flow into the rectum slowly. The container should be raised about 18 inches above the level of the rectum. As soon as the patient has a desire to expel the fluid, allow him to do so. Place him on the bedpan. Stay close by in case he should need help or support. After the evacuation, clean the equipment and put it away. Do not use soap suds. They irritate the bowel. Plain warm water is best. The temperature should be close to body heat. If you wish, you may add a teaspoonful of table salt and a quarter teaspoonful of baking soda to the solution, but this is usually not necessary. In a high fever, the use of ice water will help to bring down the patient's temperature. Asterisk asterisk asterisk. All the various water treatments we have just been describing are dry heat 103. Of real value, especially in acute infections. But there are times when dry heat may be equally beneficial. Here are several useful means of therapy you can use to treat a patient at home. Heating lamp. One good method of applying dry heat is by means of a heating lamp. These lamps make use of the infrared rays produced by a coil or plate within the lamp. This type of heat is beneficial in treating injuries and infections of the skin and deeper tissues. Another type of heat lamp uses a large glass bulb which might be either red or white. This gives immediate heat the moment the bulb is switched on. In applying this form of dry heat, keep the lamp at least 30 inches away from the skin, to prevent burning. One should remove the clothing over the part that is to be treated. Direct the rays of the lamp to the painful area and continue the treatment for 15 or 20 minutes. After this, gently sponge the area with a cold cloth or apply rubbing alcohol. A small piece of ice may then be rubbed quickly over the area. This will bring on a good tonic reaction in the skin. Sunbathing. For many centuries the beneficial rays of the sun have been used in treating various kinds of disease. Sunlight is excellent for toning up the body and killing germs. However, one must take care not to overdo this type of treatment. The sun's rays are powerful, and the skin may easily be burned. Therefore, expose the skin for only a few minutes at first. Next day expose the skin a little longer, gradually lengthening the time. After a few days the skin will be more resistant to disease. Sunlight acts directly on the body, using the natural oils of the skin, and producing a plentiful supply of vitamin D. Sunlight helps to prevent colds in winter. Ultraviolet lamp. Combined infrared and ultraviolet lamps are now available, but one must be very cautious in their use. It is easy to burn the skin. Ultraviolet radiation is a general tonic to the whole body, but like F8. 104 treatments you can give. Sunlight which it resembles, it must be taken in moderation. Never be tempted to make up for lost time by taking an overdosage, otherwise, you may get badly burned. Young people who suffer from pimples and acne will find ultraviolet radiation an excellent way to help get rid of this troublesome skin condition. But such treatment should only be taken on the advice of a physician. In general, people with very fair skin should be extra careful about taking too much ultraviolet radiation, even from the small lamps available for home use. Massage. When you accidentally injure some part of your body, the first thing you do is to rub the area. This vigorous action increases the massage 105 blood flow to the injured part and helps to relieve pain. Anything that increases the circulation to and from the injured area will aid in healing and help to reduce swelling. A special method of rubbing is called massage. It is really a combination of several different motions of the hand, including rubbing, squeezing, kneading, circular movements, and light and heavy pressure with the fingers. Massage is valuable in keeping the muscles in good condition, particularly in cases of arthritis and injuries to the joints. Before beginning any massage procedure, apply some gentle heat to the area being treated. The massage will then be more effective. Whenever a patient has to stay in bed for any length of time, his extremities and back should be massaged once or twice each day to keep the blood circulating freely. This will provide better nutrition to the tissues. Almost anyone can learn to give some of the more simple types of massage. Gentle pressure is all that is required in most cases. 106 treatments you can give. Let us imagine you are massaging someone's arm. Pick up the muscles between your fingers and gently press on them, at the same time drawing your fingers over the skin, first toward the heart and then in the opposite direction. This will speed up the circulation and help take the stiffness out of the muscles. It will also increase the blood supply to the area being treated and may help to prevent possible complications that sometimes follow serious injuries. Patients usually sleep better when muscles have been limbered up and made more pliable by gentle rubbing. Even joints that are stiffened will often respond to the right kind of massage. After applying heavier pressure, try some light stroking with the fingertips. This helps to relieve nervous tension and muscle spasm throughout the whole system. When massage is combined with other forms of physical therapy, such as fomentations, hot packs, or the use of the heating lamp, the patient will feel the benefit not only in the treated area, but all over the body. This kind of gentle treatment, given once or twice a day while a patient is in bed, will help him back to normal activity much sooner than might be expected. All these different forms of therapy show the many useful ways in which water and heat can be used in the treatment of disease. One great advantage in using these natural remedies is that there is no danger of drug addiction. Remember, there is healing power in water, and in all these simple, highly effective methods of treating the sick. Ellen G. White, one of the greatest of all modern writers on healthful living, has stated this beautifully in the following words: pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trust in divine power. These are the true remedies. Ministry of Healing, p. 120.